Hey there, I'm Molly, the nutritional therapy practitioner over at parsleyandpumpkins.com, and we are going to answer the question, what is PCOS? So PCOS stands for Polycystic Ovarian Syndrome, and the key word here is syndrome. A syndrome is a condition characterized by a group of symptoms that consistently occur together. In other words, we don't know why it happens, but it happens often enough that we gave it a name. 1 in every 10 women has PCOS, but many women can go years before receiving a diagnosis. One of the reasons for this is that the symptoms vary widely person to person. So both you and your best friend could have PCOS and each have a completely different set of symptoms. But there are 3 big signs that your doctor will look for if they suspect PCOS. So multiple cysts on your ovaries, high levels of androgens in the blood, so testosterone, and then irregular cycles, especially cycles where you do not ovulate. So you would need to have at least 2 of these symptoms for your doctor to consider a PCOS diagnosis. But what exactly is going on inside a woman with PCOS? So every month, follicle-stimulating hormone stimulates the ovaries to develop a follicle. These follicles contain immature eggs. So what's supposed to happen is that as the follicle grows, the egg matures, the follicle releases the egg during ovulation, and then the follicle goes on to become what's called a corpus luteum, which is what produces progesterone in the body. Now, in a woman with PCOS, these follicles have become fluid-filled cysts, and so oftentimes the egg doesn't mature and they don't ovulate. And it's this lack of ovulation that can lead to these irregular cycles, with each month being a completely different length. Now, the ovaries also produce testosterone, and for some reason in women with PCOS, they produce way more testosterone than is needed. So we're able to look at a blood test and see these high androgens, which can give us a sign that PCOS might be the reason for some of the symptoms you're experiencing. This can be a very difficult cycle to be in. Not ovulating means that you don't produce progesterone. High testosterone makes it even harder for your body to menstruate every month, leading to an additional factor causing these irregular cycles. PCOS is a hormonal imbalance, but the good news is that there is a lot that you can do naturally to improve your PCOS and support your body. So if you suspect PCOS, be sure to talk with your doctor, make sure that they run a full blood panel and a hormone panel to check for any other mitigating factors that could be influencing what's happening in your body. And be sure to watch my PCOS playlist for even more information. Subscribe to my channel and share this video with someone you know. I'll see you soon.